Trauma is any emotionally distressful event for somebody that may cause emotional or physical symptoms that can last years after that event happened. It could be anywhere from any type of abuse, neglect, up and also with like divorces and even school trauma. Trauma therapy is very specific. So some examples: trauma-focused cognitive behavioral therapy, cognitive processing therapy, as well as eye movement desensitization and reprocessing. What it basically does is it is to bring awareness to the client on mental, physical, emotional, spiritual level of understanding your symptoms and why you feel the way that you feel. And basically it's to help the client feel comfortable and be aware and be able to be open and honest about what has happened to them. So some of the common signs that we see for somebody that's coming in for trauma therapy, any type of flashbacks or nightmares or any type of sleeping problems related to the trauma, as well as an increased startle reflex, depression, even anger. Everybody handles trauma differently, so it can look very different in different people. So basically what therapy does to help you with trauma is, again, it's bringing awareness to why you feel the way that you feel. And therapy is a non-judgmental environment where you can feel safe to say the things that you want to say and express, what has happened to you that maybe you don't want to talk to somebody in your family about. So coming to therapy is a neutral, non-judgmental place where you can openly talk about what has happened to you and not feeling like you're going to have any repercussions for talking about it. To gain awareness of triggers is very easy to do in therapy. So we will look at all of your reactions to things and really dissecting it into what are the reasons why those reactions are happening. Once we're able to become aware of our triggers, then we're able to utilize the coping skills and other coping mechanisms that we have instituted in therapy to be able to help manage that outside of therapy. Trauma is within the perception of the person. So somebody who experiences, two people who experience the same type of trauma, one may see it as traumatic, the other one may not. So somebody who has gone through a divorce, that's more traumatizing to them than maybe somebody else. So it's all about the perception of the person and how they identify if their trauma has affected them in a negative way. And if so, then coming to trauma therapy will be super helpful for them. Absolutely not. So a lot of the times with trauma therapy is the first portion of trauma therapy is actually building rapport. So it's super important in trauma therapy, as well as identifying triggers and other coping skills, because we want to get you to a stable point before you actually start going into detail about your trauma. So we want to do a lot of education and a lot of safety planning beforehand. Then when we get to the trauma narrative, which is very typical in most trauma therapies, is that you will then have an opportunity to go into detail and talk openly about what you've experienced. And that's kind of the full circle of trauma therapy. So everybody experiences trauma differently, so it's not a one-size-fits-all. Based on how you've experienced the trauma, so whether you're fearful in one way or you're actually acting in the same way that your abuse happened. So that would be two completely different ways of handling therapy, is we're working on the symptoms that are present and getting them to a point where we can get you stabilized. Yeah, so really the harmful coping mechanisms for trauma is anything that can be harmful to yourself or other people. So for example, drugs and alcohol seem to be the most common of the unhealthy coping skills that people engage in because they feel numb. The trauma is very emotionally draining. So engaging in drugs or alcohol. It's kind of a Band-Aid that makes you feel good for a little bit, that you're not thinking about the trauma. Also overeating, as well as sometimes engaging in physical aggression towards others. So again, it's anything that can be harmful to yourself or harmful to others. Some of the positive coping mechanisms for dealing with trauma is finding something that you enjoy, finding a new hobby, being around people that you feel comfortable with and you feel safe with, grounding exercises. That's in trauma therapy, we talk about mindfulness a lot. So really learning about your body and how to really be in touch with it. And the biggest one that I do talk to clients about is getting outside. So some of the traumas that people may not recognize, bullying is definitely a big one that we see with the teen population. It can be very traumatizing, especially with the social media presence within the teen population. Also being displaced from your home, whether it be homelessness as well as being removed from your parents' care and going into foster care. Getting into a car accident can have traumatic effects, as well as medical and psychiatric hospitalizations, just again based on what you've experienced there. When somebody compares their trauma to somebody else, it adds a level of minimization to what has happened to them. We never want clients to minimize what has happened to them. This is their truth, that's what happened to them, and we want them to be aware of that. And by comparing your trauma to somebody else's, that can lead to increased depression, even some cognitive distortions, as well as a lack of validation. Anything that makes you happy and safe and comfortable. Those are the big ones that we talk about, is making sure that it is something that you feel safe. Being outside, again, in nature is a huge increase in your positive emotions. So getting outside, just taking time for yourself, doing something that you love to do and that makes you happy. So I've worked with trauma for a majority of my career, and what I have found to be the basis of successful trauma therapy is support and rapport building. Talking about trauma, it's probably one of the most difficult things to talk about. So coming into a therapy session with somebody that you don't know, expecting to talk about what bad has happened to you. So really gaining that level of trust and support from your client, that they know that they can be open with you and talk openly. And I think that's a real key to successful trauma therapy.